Welcome back to my channel, The Fitness Doula. Today, I'm going to be talking more about muscles that contribute to pelvic pain in pregnancy and in postpartum. Today, in particular, we're going to be talking about the adductor muscles. I'm going to show you a little bit about why they may be contributing to things like pelvic pain and how the common recommendation or tip to deal with pelvic pain while rolling in bed, keeping your legs together, why that makes sense from a muscles perspective. So now first, let's talk about the reason why pubis symphysis dysfunction, pelvic girdle pain is so common in pregnancy and postpartum. And that's mostly due to this joint right here, the symphysis pubis, that has a little more laxity during pregnancy and postpartum. So there are certain hormones that contribute to that, but also you got to remember that your pelvis, your body is changing at a rapid pace. So it can put a little extra pressure on that joint here, cause a little more laxity, and that's when you experience that pelvic pain. But that's not the only thing, because you've got muscles that are attached all around the pelvis that we can strengthen to help stabilize the pelvis and reduce pain. One of the muscle groups that I tend to focus a lot on with my clients is the adductor muscle group. So now the reason why I'm looking at them is because these adductor muscles are going to attach here to the pubis. Some of them come across here to the femur, and then there's one long guy that comes down here and attaches to the tibia. So because that joint tends to be a little more unstable, it tends to have a little more laxity, we need to be looking at the muscles that attach around it, seeing if they're possibly too tight, because if they're being held too tight, which is why mobility exercises may be a helpful thing. If they're too tight, then they're going to pull on that area right there. And then as you're rolling in bed, you're also having movement here at the knee that can impact this joint, which is why the recommendation of keeping a pillow between your legs or keeping your knees together as you get your legs in and out of bed and as you roll over in bed can be really helpful for reducing the extra pull and pressure on this joint. But of course, it's never that simple as just put a pillow in between your legs or keep your legs together or don't do asymmetrical movements, because your body really likes to move and your muscles really like to be strong. So we've got to look at stretches in the right places, mobility exercises, and also strength training, strengthening the muscles around the pelvis, the adductors, the abductors on the outside of your thigh, to keep the pubis symphysis a little more stable during pregnancy. And so check out my other videos on exercises for pelvic pain. I have a program called Powerful Pelvis that's all about strengthening those those hip muscles that can keep the pelvis more stable and reduce pain. And thank you so much for joining me today and watching. If you like this comment, give it a like. Make sure you subscribe and hit the bell for notifications, and comment below if you have any questions or want me to go over anything else. Thanks so much.